A new report reveals about 48% of American adults have some type of heart or blood vessel disease. It also shows that deaths from heart disease actually rose from 2015 to 2016 after declining in past years. Heart disease is the leading cause of death in the United States, followed by cancer. With simple ways to check your heart health, family physician, associate professor at Rowan University, friend of the program, Dr. Jen Caudle. Absolutely. Good morning to you.
Good morning. Happy Heart Month.
Absolutely. We've got our colors going.
Yes, we've got our colors kind of jiving. Absolutely.
We're good. You know, it's interesting about this because everyone knows you're supposed to be aware of this,
right.
But few people actually are and actually do the things we should be doing.
I think you're right about that, and I'm really glad that you mentioned the statistics. It is true that heart disease is the #1 killer of men and women. That's a big deal.
Yeah.
So I always say there are a few things that we can do to kind of stay up on our heart health and kind of understand what's going on.
Okay, and these are things that we can actually do ourselves.
Do it at home, yes. Kind of like to take almost like take your pulse on things, no pun intended.
Okay.
So,
what do we do? How do we check our heart?
So first thing is the pulse, right? So the pulse is how many times your heart beats in a minute. The normal is about 60 to 100. That's what we want to check for. And I think it's really interesting. In the course of our lifetime, our heart will beat over 3 billion times. It's a lot. But let me show you how to check your pulse. I'm actually going to demonstrate on you. So you want to find like the thumb side of your hand, okay? And this is right about here is where you feel your pulse. So I'm on the thumb side, and we just put 2 fingers there, and you can feel. Oh, there you go. You got a pulse, which is good. I feel it. So and what you do...
I was about to get concerned.
Yep, well, I got it. I got the pulse. You're good. So you want to count how many times your heart is beating in a minute. That gives you your pulse rate. Between 60 to 100 is about normal, okay? The other thing
I just got the doctor nervous. I was like, all right. So we start with the pulse.
Your heart is beating, yes.
Okay.
Start with your pulse. Of course, if you have any symptoms, you want to talk to your doctor. But that's one quick and easy way to sort of see what's going on.
Apps will do that for you now, too.
Oh, yeah, actually, that's true. Like Fitbits and stuff like that. Yeah. Absolutely. But this is the old school way. So
I'm good with that.
Old school.
You're a doctor. All right.
So the next thing is checking your blood pressure. Now, you may not have a blood pressure cuff at home, but this is where doctors come in. We want you to come in so we can check your blood pressure. Now, we think of like 120/80 as being like the gold standard, but there's a little bit of wiggle room depending on who you are and your age and things like that. But checking your blood sugar is super, super important.
And because of that wiggle room, that's one of the ones you actually want to talk to a doctor, so you don't get alarmed by what you immediately see.
Right, and so you know what your blood pressure should be for you, and it's going to be different for everybody a little bit.
Can we quickly do cholesterol?
Yes.
All right.
I want you to know your cholesterol. Do you know what your you don't have to say it, but do you know what your cholesterol numbers are?
No idea.
So you should go to the doctor. You should. So you want to get your cholesterol checked because all of these factors can play a role in heart health. The reason why we're talking about this is get your blood checked. You want your sodium, potassium, albumin, creatinine. All these are big fancy words for just get your blood work done, because all of these things can play a role with heart health. Your cholesterol, your blood pressure, your pulse, etc. And I always say to talk to your doctor about your family history. If you have a family history of like heart attacks or heart disease, your risk for having it goes like through the roof exponentially in some cases. So know your personal risk factors, also know the warning signs, but also know your family history. Very important.
We ran down some of the statistics. Like the statistics are alarming. 610,000 people die of heart disease in the United States every year. That's one in every 4 deaths.
Yeah.
That is crazy. All right, some of the tips we ran through.
Yes.
But there's some things that you can actually do to cut down on those risks.
That is right. So the first thing is if you smoke, you gotta quit. And I think I've said that almost every episode I've been here, but I'll keep saying it because I know many people try. So quit smoking. Obviously, we want you to keep a healthy weight. And by doing this, we mean exercising and eating a healthy diet. Low cholesterol, low fat, low salt. I know it doesn't sound like a lot of fun, but there are yummy, healthy foods, you know. And then make sure that you keep your blood pressure and cholesterol in check and minimize the alcohol. I think that's important too.
Everything in moderation and go see your doctor.
Yes.